we look at this whole concept of value-based purchasing, we need to ask ourselves the question, how does it impact what's going on in hospitals today? Well, value-based purchasing includes not only physicians, nurses, physical therapists, and other allied health care professionals, it even includes housekeeping or anyone who in any way touches a patient. And this is really, really important because it puts the patient at the center of the care. It's not the physician or the nurse at the center of the care.
The value-based purchasing program emanated from the Affordable Care Act, passed in 2010, and was implemented in 2013. The value-based initiative requires physicians and nurses to work together. It requires quality measures and metrics now in 4 domains. Those domains evolve within themselves sometimes to increasing numbers of complicated measures. Other measures are discarded. So the quality professionals need to stay on top of the metrics that are being required by the external regulators. In addition, the value-based purchasing program is public. So the data become public and patients, families can track those hospitals that are performing better in these 4 domains. Additionally, there are incentives and withholds associated with the program. If one performs well, one can make up to 2%, and if there's poor performance, as much as a 2% loss. And you say, 2%, not much. Well, it's 2% of Medicare payments, which can be hundreds of thousands of dollars for most hospitals, even smaller hospitals, 50 to 100,000, over $1 million for a larger hospital. So this becomes a very substantive quality and efficiency performance program.
Revenue is really important to hospitals because it allows the hospital then to make sure that they have sufficient resources available to take care of their patients. So the economic impact to a hospital system based on the amount of reimbursement they're receiving from value-based purchasing is crucial to what's going on within the hospital system and how successful they're going to be. The other part that's a big challenge around value-based purchasing is procedural and clinical. Every year, the CMS changes the measurable outcomes that they're looking at as far as what we're doing with patient care. So every year, hospitals have to re-educate the staff to make sure that they're providing the best evidence-based care to their patients year after year. And this becomes a very daunting project for a hospital system. It also means that hospitals need to have the best point-of-care tools available for their staff so that there is a standard or the highest level of care available and information available to the clinicians to provide the best care. We at Wolters Kluwer have actually done research around the use of our point-of-care tools, Lippincott Procedures and Lippincott Advisor, and their impact on value-based purchasing scores. And we have found that, yes, they do have a positive impact on the VBP scores.
Let me now take this opportunity to share with you the results of a very important study. For the past 30 years, Rockburn Institute has been doing clinical analysis studies. We track the literature, and it's rare that we find a project, initiative, a study where we can clearly associate the intervention, the application, with change in practice and improvement in quality. This, you will see, is the case in this particular project. And what are the results of this exciting study? This enumeration study demonstrated the average percent rank of the 41 hospitals' total performance score was 24.5% higher when compared to hospitals that did not have the same level of usage of both Lippincott Procedures and Lippincott Advisor. These results are stunning, and we say to ourselves, how come? Why might this be? My view is that within the nursing staff of most hospitals, there is a very strong intellectual capital. And what the Lippincott Procedures and Advisor tools do is to provide augmentation, addition, at the bedside when needed. Thus, we see a close relationship between the nurse, the information, the patient, and the performance improvement, which leads to improved quality and efficiency.
So it becomes incumbent upon hospital systems to provide point-of-care tools that are based on the best available evidence to their staff so they can optimize their practice and optimize patient outcomes, which in turn will optimize reimbursement.